Hello, this is Dr. Ayu. Today I am going to cover the rest of the uterine pathology of the female reproductive system, and in the leftover of the uterine pathology, the leftover part is the malignant uterine neoplasms. I will discuss today cervical carcinoma, endometrial carcinoma, and the leiomyosarcoma. Okay, so these are the three cancers are more common and in the female reproductive system, and I will discuss all those things about the epidemiology, history, onset, signs, symptoms, and staging and sonographic appearances. Okay, so after that I will start with ovarian pathology. So let's finish this part first. Okay, let's move on to the cervical carcinoma. Cervical carcinoma, we need to understand that cervical carcinoma is the cancer to the cervix of the uterus. Okay, so now it is, let's say, cervical CA, squamous type. Squamous cell carcinoma based on the epithelial cells. Okay, so cervical carcinoma etiology. It is the sixth most common cancer in women. Highest incidence is in a 30 to 47 year old. Okay, you can say it's a middle age, right? During the fertility time, or say even 47 is a premenopausal. Some people can get menopause also at that time, at the 47 years old. And the risk factor under 20 at first coitus. Coitus means intercourse, okay? Then multiple sexual partners. Genital warts. Usually it is herpes type 2. Genital warts. Type 2. Then young at first pregnancy. high parity means many childbirth, history of many childbirth, and smoking. Okay, and those who have human papillomavirus, HPV, number 16 and 18. Okay, human papillomavirus. There are so many types of papillomavirus, so 16 and 18 are more common. Okay, so these are the risk factors, and the best way to diagnose of cervical carcinoma is the pap smear. Okay. Best way to diagnose the cervical carcinoma is pap smear. M-E pap smear. If found early, the cure rate is close to 100%. Okay, so let's review these risk factors. Under 20 at first sexual intercourse, multiple sexual partners, definitely with unprotected activities, genital warts, herpes type 2, young at first pregnancy, high parity, smoking, and the positive case of HPV type 16 and 18. The best way to diagnose the cancer is pap smear, and if it is found early, the cure rate is close to 100%. Okay, now we'll talk about the signs symptoms. Signs and symptoms. Early signs are, or you can say early symptom. Early signs and symptom. Bleeding, after intercourse, and and pain on contact. Pain on contact with anything touching the cervix, patient says, oh, it's pain. And the left sign and symptoms: pelvic pain, swollen lymph node, and bladder discomfort. Okay, so early sign and symptoms would be bleeding after intercourse. Patient will complain that I'm having pain during intercourse and also bleeding. Okay, and the patient will be scared and patient will be nervous and they will go to the doctor and doctor will take the history. Is it happening every time when you do the bio activities? Oh yes, it is, and it's very painful. And the late is pelvic pain. It's a dull pain all the time. And the swollen lymph nodes, lymphadenopathy, and the bladder discomfort. Maybe it is metastasized to the bladder wall. Okay, and it goes to the surrounding tissue in the pelvic cavity, and that's why the lymph glands are swollen, especially in the pelvic region or pelvic group of or iliac group of lymph nodes. Okay, so this is signs, symptoms, and the staging of the cervical cancer. Staging of the cervical cancer. Stage 0. The cancer is non-invasive. Cancer is non-invasive. That means cancer is in situ. Okay? It did not invade into the surrounding tissue. It's locally malignant. Okay, 0. And stage 1. The cancer is small and confined to the cervix. Confined to the cervix. Stage 2. The cancer extends beyond the cervix. Beyond the cervix, but not through the pelvic wall. It may involve the vagina. That is stage 3. 2. Stage 3. The mass is large and involves the pelvic wall, uterus, and vagina. Regional lymphadenopathy. Regional lymphadenopathy is present. And the last stage, stage 4, the cancer has spread beyond the pelvis, beyond the true pelvis. And involves adjacent organs. Distant lymphadenopathy and metastasis. Distant lymphadenopathy and metastasis. So these are the 5 stages. Begins from the 0. So 1, 2, 3, 4, 5. So that's the way the 5. Okay, so problem is when it is diagnosed, those who have never pap smear and they diagnose at the stage of 3 and 4, where the distal metastasis is already spreaded. Okay, so it is very hard to control. But as we know that cervical cancer, the first screening evaluation is the pap smear. Pap smear can identify the atypical cell present in the cervix. So stage 0, stage 1 can easily be identified as atypical cells found in the cervix, and the patient will be followed up, and if it turned into non-identified cells more and suspicious, then they will do the surgery, okay, followed by radiation. So that's the way the management of the cervical cancer is conducting. And now I will discuss about the imaging procedures. So what are the modalities are used to evaluate this cervical carcinoma. Imaging procedures. Colposcopy is the utilization of a low powered microscope to look at the cervix. It can detect small masses on the surface of the cervix such as wart, sonography, it plays a secondary role in the evaluation of the cervix. Ultrasonography is a poor screening tool. Because it is unable to diagnose early cervical cancer. Okay, early cervical cancer sonographically you cannot identify. And sonographic appearance in ultrasonography, the cervix will enlarge. Enlarged cervix and it may contain an irregular solid mass. If the cervix is the same size as the fundus, then a mass should be suspected. Okay, so we understood the colposcopy. It is the utilization of a low-powered microscope to look at the cervix. That means an instrument is sent through the vagina with the vaginal canal opening, and the instrument has light and magnifying glass, so you can see the cervix very clearly and enlarged and bigger, right? And it can easily detect the small masses such as the wart. And sonography, it is the secondary role because it cannot evaluate the cervix correctly or completely. Ultrasound is a poor screening tool because it is unable to diagnose early cancer. Sono appearance, if you see, there will be enlarged cervix and it may contain an irregular solid mass. If the cervix is the same size as the fundus, then then a mass should be suspected. Okay, now I will draw the diagram sonographically. Sonographically, what you gonna see? Sonographically, draw the cervix. Okay, so this is cervix, this is normal cervix, but you may see, I'm drawing here, now look at here, the first of all, it is almost the same size as the fundus. And then you will see a mass with irregular surfaces. Or you might see the irregular border of the cervix here, and you feel like there is something wrong here because you will see the lot of shadowing. Okay, when you see like this, then definitely you have to figure it out that this could be an suspicious masses. Look at the cervix. Lot of times you will see the bladder is may not be completely full,